Hello, good afternoon. Sarah Jane here from TYPP and Poshami. Perfect. I am on today. We're just doing a live, so I'm live. If you have any questions, please just heads up. I'm just checking that you can all hear and see me. I think you can. Let's check. Yep, there we go. So I'm going to talk today about low-level laser therapy. So something that we recently invested in the clinic here. So I'm in the clinic room in our studio in Glasgow. So for maybe many of you watching this that don't know where we are, we're in Kinning Park in Glasgow, and we have it's a full rehabilitation centre. So we have, maybe see in the background here, reformers. So we have 10 reformers in the big room through here, and then we have a semi-private rehab and tower area just kind of behind me here. And then this is one of the big clinic rooms where we offer posture assessments, biomechanics assessments, human movement assessments, physical therapy, podiatry, facilities, basically services here in Glasgow. And we have 3 treatment rooms. There's myself and some other therapists exciting coming on in September as well, but I'll tell you more about that in another video. So I wanted to talk about pain. A lot of clients come in to us with pain. Really, it's one of the main reasons that people are coming in. They're feeling stiff, they're feeling sore, their joints are aching, they're just not feeling great. They're maybe just feeling lethargic as well, and just really feeling just not great. So one of the things that I had been looking at was how can we best and more help more people, and looking at different modalities. So we offer many different things in here that including sports therapy, sports massage, we do cupping, dry needling, and many of these modalities help. We've got shockwave as well that we do. But we were needing something for that almost acute stage or very, very sensitive stage of pain where maybe there's been initial injury, where there's a lot of swelling. And we needed something where we are targeting the reduction of inflammation, whereas shockwave therapy and things like dry needling, medical acupuncture, actually do the reverse of that. So we were missing a modality there, and this is really where the laser came in. So this isn't like a laser where you would go for like IPL and hair removal, things like that. It's not at all for that. It's low level medical grade 4 laser therapy, and it is primarily really getting you out of pain. That's primarily what it's used for. It has many, many uses for me, especially myself. I'm a podiatrist, so I can use it on patients for wound healing. So obviously, we may be doing different procedures to you that we may cause a wound, for there will be some reason for that. Maybe nail surgery, maybe we're cutting something out of your foot and there's maybe been a wound created, but all within a controlled manner. But this has been fantastic. The biostimulation mode in this has been great. So I've used this quite a lot with our nail surgery healing. And what this is showing, it's early days yet, but for me, in my own research, is seeing that the wounds so far are healing faster. Now, I don't say that lightly, because seeing that you can speed up the healing process is a big statement. But so far, so good that the patients that we've had in, where we're now seeing them for nail surgery, and then they're redressing and looking after them after the surgery, we're using the laser in between appointments and what basically on the biostimulation setting to help with that modular action, cellular action, to get tissue basically healing. So we're creating the perfect environment for the body to do what it needs to do to essentially heal. So that's been really interesting. And I know that a few other colleagues around the UK have been getting some great results with chronic ulcers for patients maybe with type 2 diabetes that are struggling to heal those ulcers. And if that's the case, if you know anyone like that, I'm sure you can appreciate how chronic and stressful and life-limiting living with foot ulcers can be, and not to mention life-threatening. So the fact that we're seeing some great results in actually getting these chronic wounds, and we're talking some of these wounds can be years to heal. Imagine having to deal with that for years. So that's been that. I'm really excited about that as well. But personally, I don't see a lot of big chronic wounds in this clinic. It's primarily wounds that we've caused because we've been doing some surgical procedure and seeing the difference in how the patients are healing. Now, obviously, those patients aren't all the same. They don't have the exact same history and background, so that research is very clearly biased. It's not, there's no randomized controlled trial there. It's literally just what I'm seeing in clinic, case study, and so far the results have been great. So that's one thing that we can use it for, is that tissue healing and getting better results. I'm just checking if you do have any questions, please just type it in the box and I'll answer if you're unsure of what we would use laser for or what it does, or any other questions, just ask. Essentially, when I'm using this, so I'm not switch it on just now, but essentially this is the handpiece and this is the laser. I would be wearing protective glasses as I wear this, because the actual laser light that comes through this is invisible to the naked eye. So when I'm working with this, it just looks red, and actually it's kind of white when it's on, but you can't see that through with your naked eye. So, but essentially, the patient, you don't feel anything. It's literally just, say, we'll put it on the skin. It's literally on the skin. If I was doing biostimulation and there was a wound there, I wouldn't be touching the skin for infection reasons. So it would be hovering above the skin and generally moving. But effectively what we're doing here is we start with what's called a scan phase. And what we're doing with that is stimulating the cells, getting all the cells revved up. We're basically increasing ATP synthesis. So ATP is the energy within your cells. So we're stimulating your cells, usually depending on what pathology you're coming in with. So a lot of things we see in here are plantar fasciitis, right? Tons of plantar fasciitis, that inflamed absolute hell of pain in your feet that just would drive you doolally. So we see a lot of that, and pretty much instantly within one treatment, because of that reduction of inflammation, people are leaving feeling a lot better. Usually for something like plantar fasciitis, you would need about 6 treatments, about that. And each treatment, to just give you an idea, is just the same price as a normal treatment. You don't actually pay a lot extra for doing laser. It is £50 per treatment, so it's not, it's not big scary amounts. So I hope that kind of answers that question for anybody that was worried about price. Essentially, what we're kind of doing when we're doing that scanning phase, right? So when you're in a state of like this, maybe you've got a big bout of inflammation, or you've got a chronic injury, so something that's been niggling or been going on a long time that you just can't break the back of. What we're initially doing with this initial scanning phase is we are increasing that ATP synthesis, right? But we're also allowing it to, the proteins essentially within your cells to bind to the ATP, right? And then this allows that to be more accessible. Essentially, if you think about your body able to access it and metabolize it better. So you're essentially giving your cells a big rev up. So if you're in like a kind of chronic injury where nothing's kind of happening and it's maybe still really, really sore, where if we use something like Shockwave, it would just, the pain would just be too much. You wouldn't tolerate that treatment. This is really where the laser can come in and work a treat, because it's completely painless, but it is working in a different way and a different cellular action, because we are calming the inflammation down. So I hope that makes sense. This also releases the growth factors, fibroblasts, and other substances, essentially that kind of cell regeneration as well. So, I mean, Shockwave therapy does that as well. And you're also increases basically is a protein called, I think it's your it's your NLRP10, and it's a protein that increases the anti-inflammatory protein, right? So let me break that down. So essentially, what we are doing is we are increasing the production of that protein that essentially basically is anti-inflammatory. It's reducing inflammation. So instead of you having to take like naproxen or some sort of anti-inflammatory, where you're systemically taking something, we can go straight to where the inflammation is actually the problem and basically change that cellular action right at the point of where the problem is. So fantastic, just fantastic at that cellular action. It's a funny one because you're not feeling anything when it's on. So I'll show you it on. These rays do not go through your camera, so you're not going to be harmed by this. I'll put my glasses on because I'm going to be putting the laser on. Essentially, see this up. And when this is on, okay, it'll just look red on my skin. Do you see that? But you can actually see that white. So I'm sure you can see that there, the kind of white dot. I can't see that here, right? So when I look at that from this end, it just looks red. It just kind of looks like a red. See that? Like the kind of X? That's all it looks like for me. But essentially, I can't see that white. Hence why I put the glasses on. Essentially, no matter what part of your body I was working on, this would be the scanning phase. I would be scanning and stimulating the cells, okay, all the way up. And actually, my thumb has been annoying me, so it's quite nice. So essentially, we do the scanning phase. Now, what this feels like for you, it doesn't feel hot. It doesn't feel burny. You're really just going to feel a light touch, nothing happening in terms of you discomfort. So essentially, what we're doing here is stimulating those cells. After we do the scanning phase, right, so I'll turn this off. After we completed the scanning phase, we then go into the pathology setting. So depending on what I'm working on, so for example, what do acute pain, let's do Achilles tendonitis, so with that setting, what would happen here is I would be on certain points within. So you can see here again. Okay, so say for example, this was your foot. I would be placing this for a period of time onto your tissue, and it would most likely be getting held depending on what outcome I'm looking for, what I'm wanting the cells to do, what action I'm looking for. Usually when we're doing this as well, we will be asking you to be moving your joints at the same time as well. And that is just so that we get that light, basically that laser light through into the tissue. So you can see how the laser kind of light shines here. But essentially, as I do this, it just honestly just feels like I am just a nice gentle touch. It doesn't feel sore, okay? So that is what it looks like. Now, usually if I was, for example, treating, turn that off, if I was seeing you, if we're talking plantar fasciitis, so there's inflammation there, what we're trying to do is we're trying to get you out of pain, right? Because the reason that you're getting a pain output is usually because the tissue is responding in a way due to not being able to cope with the forces that are going through it. So we deal with a lot of, obviously the full history, we'd work out why your tissues are responding this way and get a plan in place, right? So it's not just a case of we just come in and laser you and don't fully assess you. So that might not be the appropriate modality for you. So we would fully assess, get a diagnosis and get a plan in place. But the main goal is to get you out of pain. And the laser can really help with that because of the reduction of inflammatory. So essentially it can really help with that. And that's been a big game changer for me personally in clinic because, as I said, it was one of the things that we really found we were lacking, that those patients that were coming in really very, really sore. So even palpating around the area, they were at a 10, they were like screaming, that's really, really sore. You could even see the red, hot, angry tissue. And going in with something like Shockwave to that, you wouldn't thank me. It would be pretty sore. The laser's also really great for reduction of edema. And also, so if you get swelling, so for acute injuries, so say for example you've been moving over your knee or your ankle, fantastic for that, because a lot of the time the pain that you're getting around your injury site is due to the increased swelling in that area. So if we can reduce that swelling, reduce the edema, then we will reduce the pain. Also for muscle spasms, and again, there's actually many things that we can use in clinic for muscle spasms, and laser is just one of them. The myofascia tool, so we have a tool that we can put on the shockwave machine that is also fantastic for muscle spasms. So if you ever kind of found that your lower back or your hip or something's been a spasm, maybe you've got some mechanical problems there and other muscles are compensating for that, and you're just like, oh my God, I just really need a deep tissue massage. I need that eased out. Oh boy, that is phenomenal for that. So usually what I will do in those instances, when I know the patient, I know that's what it is, there's a mechanical issue there, we're dealing with that, but let's get you out of pain in the process, because we need to rehab you. And you're not going to be able to do your rehab if you're in pain. So I need to get you out of pain so you're able to do your rehab. And I love utilizing the shockwave machine with the laser, but usually on the myofascia setting of the shockwave, which disperses the shock waves. They don't go as deep, basically. It feels deep to you, but trust me, when you're getting shockwave, because we're working on a tendon that's maybe chronically just needing rehabbed, and it's just in that chronic cycle, you feel how deep that goes. It's pretty intense shockwave, but it's very effective. Especially for tendons. So utilising both of those modalities on kind of the patient's tissues has been an absolute game changer in our clinic, to the extent where clients have been not needing to come as often. So as well as a podiatrist, I'm a sports therapist, so I treat the full body. But I've very much come with it focused on human movement and biomechanics from my podiatry background. So I've had, over the years, I've had many clients that come to me regularly for sports massage, and they've not needed to come as much. So yeah, they're just like, you've just, the way that you're utilising different modalities, that my kind of effect of how the muscles feel lasts a lot longer. So that's been great. It's been great, one, because they're not having to come as often. They're getting the results of that really deep tissue massage and that release of the muscles without, say, the neck or the lower back getting into a spasm. And it means that I'm then able, my diary's more open. I can see more patients coming in. So it's great. And that's what I want. I want clients to essentially not need me. That's the goal, isn't it, really? If you don't need me, I've done my job. So that's just a little introduction again to laser. I'm trying to just, I appreciate that. What do these machines and things work for? Because when you hear laser, you immediately think like hair removal, or it's going to be sore and it's going to burn me. I actually get laser done on my like age spot. That burns. It's not like that. It's not a laser that is going with them. So it's great. I've got a lot of older patients. As a lady in, was it yesterday? What day is today? It would have been probably Monday. And she's in her 80s, right? So she's got arthritis in her knees, and she's just demented with it. So she's been coming and been getting laser, and the result with that is phenomenal. When you hear from their son who comes here for his back problems, says, my mum's been amazing, Sarah Jane. I can't believe the difference in my mum, and that she's up and able to walk about more. And that's the goal, because the whole issue with, the more you sit about, the more you stiffen up, the more the joint deteriorates. Actually, people think, if I don't move, I'll not use it and it'll not wear out as fast. But actually, it's the opposite. You need to move and use it. So that's been an absolute delight to just see someone that wants to stay on their feet. They're well into their 80s and not wanting to have a knee replacement at that age. That's quite a big surgery, and it's quite sore. The recovery is quite long for that one. And so helping with that pain is, I don't know, I feel a great privilege to be able to do that. And that really has been the game changer with the laser, because I really wouldn't have had a modality really that could have made that sort of impact on that patient. So for arthritis, it is phenomenal because of that reduction of the inflammation, the reduction of the muscle spasms, and what it's doing at that cellular action. That really is the game changer there, because I couldn't have used something like Shockwave on that patient. She just wouldn't have tolerated that. Her tissues just, that would actually be cruel to do something like that. Yes, I could have used massage therapy, taping, cupping, dry needling. There's multiple things I could have used there. But again, even then, that would have probably been a little bit uncomfortable for her. But also wouldn't have given as big an effect, because I'm not really with my hands massaging, reducing the inflammatory proteins, right? I'm just not doing that. Whereas with this, I don't know, it's all about sci-fi. I love it. I love that we are able to impact the tissue at that cellular level, and that we're able to change what's happening there, really thinking about, right, what we're trying to achieve, and then being able to utilize different tools to help us achieve that based on that patient's needs. That just blows my mind. So yeah, that's a little bit about the laser. If you are in pain, no matter, you might have tried lots of different things, please don't hesitate to reach out. This is a really advanced piece of technology that we've invested in the clinic. We absolutely, we got it on trial initially. The manufacturers were so convinced that we'd love it. So I thought, okay. So they gave us it to try out in patients. I thought, right, okay. And I was very transparent with my patients. I'm trying this out. Give me honest feedback here. I don't want to hear, don't tell me what you think I want to hear. I want the truth. Like, are you noticing a difference? Really, because I don't want to be investing a substantial amount in that sort of technology if it's not. And the feedback, well, let's just say we got it because we were like, we can't not. And that was it. It just was a bit of a game changer, really, for particular presentations of injuries and pain that we're getting in clinic, and utilizing that with other modalities. Oh, I think you can probably tell my excitement at that. I'm going to check if there's any. Hi, Fiona, I can see you're there. If there's any questions. But if you do have any questions, don't hesitate. Please just ask. I appreciate that it's all very, you sometimes think, what do I need to book? Say, for example, you've got knee pain, hip pain, lower back pain, foot pain, you've just got something going on, you're sore, or you just don't feel right, and you just think, I don't even know where to start, because you might have a few things going on. A lot of people that come into me usually have, the problem might have started at their feet, but it might be their lower back that's now hurting as well, or it might be vice versa. Usually what people do with me, I can't show you this, it's a patient's assessment. Usually what I do, if somebody's coming in, I would always recommend that you book a biomechanics assessment. That would be the best thing for you to do. And the reason I say that is because I get absolute time to thoroughly assess you. Right, your biomechanics assessment is all assessments. There's no treatment in that appointment. Essentially, you probably see the treadmill here, and we have our digital insole. So we fully assess how you move, right? And we take a thorough history, full medical, everything that's going on in your life, right? Even from birth right through. We look at you as a whole. And then from there, we then start to problem solve, right? We start to unpick things, where you're sore, how you walk, how you move, how you ambulate, any past history, any past trauma. We unpick it all. And then from there, it's like you're like a big giant puzzle. It's about putting the pieces together to then work out, well, why are you getting that pain output? So that's always where I would say, if you can invest, it's £120 for a full biomechanics assessment. And it's an absolute bargain, honestly. And with that, you get a full posture screening. We use the digital insoles, you're on the treadmill, not running, we're analysing your human movement. And when we've got the digital insoles in, essentially they go into your walking shoe or your running shoe, whatever you wear most days, you put it in there and it objectively picks up that data. So rather than just my eyes, where it's more subjective, it's just what I see. I do that as well. I use my eyes, but the data that comes out of the insoles shows what your feet are doing, exactly what muscles are contracting, right up to your ankle, to your knee, to your hips, to your lower back. It picks up exactly what's happening and when. It again blows my mind. I love tech, so that just excites me. So obviously I am watching how you ambulate as well. So I do a subjective assessment as well. But old school there, we film you and really slow it all down and watch exactly what your movements are. So we watch you from behind, from the front, from the side. We film that, we slow it all down. So we see what's happening. And then based on your whole picture, right, based on you, because I can't say this is exactly what happens because it depends on you. We then will do more clinical assessments to then unpick even more. From there, what we then have is a clear picture of where you're at, and we can then come up with a plan. So after doing your full biomechanics, human movement and posture assessment, you get a full report of findings. We do a posture assessment at the same time. You get a big printout. I'll not show you this because there's somebody coming in later to go through their findings. This is a patient's posture assessment. We send you that digitally as well as print it out, and we go through what all those findings mean, right? And it's almost like most of the patients that it's almost like a kind of it just makes sense, right? And then from there is then about, well, let's build out a plan going forward. Where do we go from there and what do we do with that? And that's different for everybody, but it gives you a plan. And that plan can include, yes, it might mean that we're doing something else with you. It could mean that you need a rehab program for home, so we would do that for you. Or it might mean that you need some sort of form of custom orthotics. We can totally do that. We manufacture and make them all in here, so we can absolutely do that if there's something there. So for example, this patient that's coming in later, we found that she had a leg length discrepancy, a true leg length discrepancy, not an apparent, meaning it was osseous, it was bone, not soft tissue, making it look like she had a leg length discrepancy. So that needs dealt with. She's getting issues with her hip, can't run anymore, getting really frustrated, young woman. And it's quite a simple fix with that one. Bit of rehab to sort out the tissues, build her back up, and we need a customised orthotic to balance her posture out. Not an issue. She won't need to see much. She's obviously been in for a clinical assessment. She's back in today. We're going to go through that. We'll make her customised orthotics to give you an idea. Anywhere between, if we're making them in-house, anywhere between £85 and £150, so they're not crazy expensive. If we send them away to the lab, they're about £380. But not everybody needs them sent away to the lab. You really only need them sent away to the lab if you have something fairly significant that I can't make in here. 95% of the patients that I see, I can make that in. I can customize your insole in here. We utilize a technology where we take a mold of your feet. We heat the materials depending on what type of material we're going to use, depending on the prescription, and then we customize and add prescription based on your requirements. So it's all very customized, but they are generally made within the hour. So this particular patient that's coming in today, she'll leave with her insole. She's coming in, we're going to mold her feet, and we have the materials already. I will then take the mold. I will then take that through to my lab, with my grinder, my additions, all my prescriptions, and I then add my prescription on, and she will leave with them tonight. So we've got a whole package of things that based on your findings. So not everybody will leave with a pair of insoles. Can I just say that? Insoles are always second line. I wouldn't give out insoles unless it was absolutely, that is what you need. You need this. And if it's something you maybe just need for a short term, for a current injury, just to get you over the hump, then that'll be part of your management plan. It might be something where you have a fixed deformity where no amount of rehab is going to fix that. Then that's where we're at. We have to utilise the tools that we have. But rest assured that if we can rehab it, it's always going to be first line. If we can get you back to full function and out of pain without having to bring in some orthotic device, we'll be doing that. But I hope that kind of gives you a wee taster. And yeah, I'm just checking here. Are you needing a plinth, SJ? John Boy's messaging me. I'm going to go and get a coffee before my next round of patients. And yeah, just reach out if you have any questions. If you're watching this on replay, just message in the comments box. I'll definitely be about to answer them over the next whenever you see it. We'll do our best. And if you're watching this, because I will put this up onto our blog on our website, feel free to just pop us a wee message. The details will be in the blog underneath this on how to do that. All right, I'll see you all later. And I would say enjoy the sunshine, but in Glasgow today it's a bit, I've actually got the heater next to me today because I was a bit chilly, which I can't believe I'm saying because it's been roasting. But anyway,